Bismillah Rahman Rahim. Today I will talk about communication station on H. pylori, Helicobacter pylori. So it is very common scenario in MRCPCH clinical exam. So before that, there is a common mistake which candidates are doing. They are calling the role player with the wrong name, and sometimes if they are like speaking to the mother, they call the child name with the wrong name. Sometimes they call the mother with the child name and child name with the mother. So it is very important to write the in names when you have 4 minutes before entering in the exam. So you have to write the name of the mother to whom you are talking, and also the patient's name if same patient is okay, and if it is a child you should have to write the age and their diagnosis. So outside 4 minutes are very important. It is total 9 minutes station, 4 minutes before you are entering in the exam. In communication station, it feel like you should have to behave. There is a no examiner. Examiner is there only to observe you, observe your body language, facial expression, tone, and have you completed all the task, have you given how you communicate your task. So it is totally communication station. So it is very important you should aware of all these things because it contains 8 marks, and it make a huge difference to communication station in MRCPCH clinical exam. Okay, so today we will discuss about the Helicobacter pylori, and role player are asking a lot of question in Helicobacter pylori. So what is H. pylori or Helicobacter pylori? As you know, in all stations, in communication station, you should have to introduce yourself. You should have to make the repo. You should have to clear your role. Don't be afraid. Whatever diagnosis they have, just tell them, I came to know that you are suffering from this condition initially, so that role player knows that you are aware of the condition. Okay, sometimes many candidates, if child is suffering from acute lymphoblastic leukemia, and it is very clearly written in the scenario that child has been diagnosed with ALL 6 months before or last year, he is on active chemotherapy. So it's better to tell the role player that I came to know and your son or your daughter is suffering from acute lymphoblastic leukemia, and I'm sorry to hear this. So it's okay to say this. It's some candidates, many candidates, they hesitate to say the condition already they have diagnosed. So initially you say the call the condition because already role player know this is the condition, and then you can use the condition. Don't name the disease again and again. Okay, so ask for the attendant and the previous knowledge, and after at the end you should know about the summarization. Okay, never forget summarization. Okay, so about H. pylori, as you know, this is the Helicobacter pylori, and how to explain H. pylori, you have to draw the stomach. So, stomach, as you know, this stomach has the protective line, and this bug will infect this lining. So, in our stomach, or you can say the food bag, in our stomach there is a acid, so it will happen digestion. So because acid is harmful substance, it can harm the stomach. Because of this reason, naturally stomach has the protective line. Okay, so this protective line is protecting a stomach to be harmed from this acid substance. So in H. pylori, in Helicobacter pylori, what it will do, it will damage this protective line. Okay, so this is the explanation. So from where I did get this bug? So this is very important question they are asking. As you know, H. pylori is it's not very sure how it's not very understood exactly how H. pylori spreads, but it is thought to be that spread person to person, and usually sometimes from the contaminated water, contaminated food, or from the feces or saliva of the infected person. So sometimes role player will tell you, if it is a girl, that my boyfriend has a tummy pain. It means does he have this H. pylori infection? So it is we are not aware that only tummy pain doesn't necessary that they have the bug. So there are also other symptoms as well. So is it serious? it can be serious if it is not treated on time. It's not treated early. Okay. So as you know, we are giving three medication, two anti-bug medication and one acid suppression. Okay, so omeprazole. So you have to tell the examiner to role player two anti-bug medication to eradicate this bug and one for the acid suppression so that you will not feel the discomfort, bloating or vomiting, throwing up or nausea. Okay, so this we are giving medication. Why too much medication? How do I know that the bug is eradicated? This is very important question they are asking. So if your symptoms persist, we will do the your poo test and we will see a screen, or we will screen your poo test and we will see that we will trace the bug in your poo. So stool test is for the to see it eradicated or not. Usually they don't do if patient became asymptomatic and there is no any concern, but if patient is still symptomatic, they will check by the stool test. Is it stomach cancer? This is the question has been asked because my aunt or my grandma had a stomach cancer. I'm worried that I have a stomach cancer. So no, it's not the stomach cancer. It is only these symptoms. Whatever you have symptoms, these symptoms are because of this bug, as we already diagnosed, and this bug can be eradicated permanently from your body. So don't worry, we are giving you medication, but make sure that you complete the course of anti-bug medication. Okay, what will happen if I don't take treatment? So if someone is not taking the treatment properly to eradicate this bug, then this protective line will be affected and it can affect the stomach line and it can cause the uh, uh, it will cause the injury to the stomach and it can bleed from there. So because of this the person may have the low hemoglobin, their blood level in the body can be low. They can have the loss of blood from the poo or they throwing up the blood, so it can be harmful, and this injury to the stomach or food bag is harmful in long term. Okay, my friends or my classmate has a tummy pain. Did I get it from them? It's not sure. Only tummy pain is not does not necessary that they have this bug until unless we don't do some test and some specific symptoms, then we can say they have the Helicobacter pylori. What about my other family members? If any of your family member who is having symptoms, who is suffering from bloating and abdominal tummy discomfort, or they have the throwing up, or they have indigestion, we will do the test. Otherwise, if they don't have symptoms, we will not do. Do they need investigation? No, until and unless they are symptomatic. Shall I isolate myself? No, you don't need to isolate yourself, but make sure that frequent hand washing, and especially when you go to toilet or come back, it's better to wash hand and before eating and after eating. So frequent hand washing is very important, and usually it can be transferred from the saliva, feces. So these are the things can be it can be transmitted through this. Okay, so this was these questions commonly asked in the exam, which I discussed with you. So what is H. pylori? Little bit outline, little bit explanation of H. pylori. So H. pylori is a bacterium that can infect the lining of the stomach and duodenum. So as you know, it can cause the ulcer. Okay, approximately eight out of nine people who have it does not cause any problems. So many people who is having this H. pylori, but they don't cause any problem. So we don't know why some people cause having the symptoms, some people doesn't. Okay, so therefore do not require treatment. So even though they have this bug and they are asymptomatic, we are not worried. They does not require any treatment. So what are the symptoms? They might have the nausea, bloating, indigestion, tummy discomfort. So these are the symptoms of this condition H. pylori. Not very understood exactly how H. pylori is spread, but it is thought to be spread person to person, contact with saliva, vomit, feces from infected person. So as you know, diagnosis by symptoms, urea breath test and stool antigen test. So these are the tests they will do in this. And treatment, as you know how to manage, it consists of three different medication. Treatment is consist of three different medication, two for antibug medication and one is acid suppression, acid lowering medication, which is omeprazole. So you should have to take around 1 week to 2 weeks. It's according to the usually nowadays they are giving 1 week, so you can say 1 week to 10 days. And in some areas they are also some they are giving, in some areas they are giving still for the 10 days, even for the 2 weeks. So it depends, it's very area to area. So you can say 1 week to 10 days, two antibug medication and one for the acid lowering medication. Okay, so this was the scenario of H. pylori in the exam. So these are the questions they are asking. If you are aware of answers, it would be very easy. Make sure that you summarize when there are 3 minutes remaining. Still, you can reply of two questions because you have 2 minutes. The last 1 minute, keep in mind that you will summarize whatever you have discussed, summarize in 2 to 3 lines, and then you should have to provide the leaflets and trusted websites. If scenario is very like leukemia, like any other thing, then also the support groups. So this was about H. pylori. Thank you very much. Subscribe my channel before you are after watching this video. Thank you very much.